Maybe you've noticed a little spot on your hand that wasn't there before. Or perhaps a mole that you've had for years seems to be looking a bit different lately. It's easy, isn't it? So easy to just glance at it and think, oh, it's nothing. Or, that's just part of getting older. We see changes on our skin all the time. Little bumps, rough patches, new freckles. Our skin tells a story of our lives, the sunshine we've basked in, the scrapes we've healed from. But sometimes, just sometimes, a seemingly small change on the surface can be whispering a much deeper, more important secret. It's a painful reality that we often dismiss these subtle hints, thinking they're harmless, when they could be a sign our body is trying to give us a warning. It's like a quiet alarm bell, barely ringing, easy to ignore in the hustle and bustle of everyday life. But what if that tiny, easily overlooked spot was actually pointing to something serious, something that needs your attention right away? In this video, we're going to gently uncover some of those silent whispers our skin might be making, looking at important changes that are easy to miss but crucial to notice. These aren't meant to scare you, but to empower you, to give you the knowledge to spot something early, when it's often easiest to handle. Stay with me, because you'll want to understand these silent signs. Watch to the end for something that will surprise you. Now, thinking about these changes on our skin, one of the most common things people notice, and sometimes dismiss, is a new bump or a patch that just doesn't seem quite right, and you might see something that looks like a little pearly, waxy bump, maybe on your face, neck, or ears. It could even look a bit like a pimple that just never seems to go away. Or maybe it's a flat, flesh-colored or brownish spot that looks a bit like a scar, but it just appeared out of nowhere and it feels firm. Sometimes, it might even be a sore that crusts over and heals. But then it just comes back again, day after day, week after week, never fully going away. These kinds of spots, bumps, or non-healing sores are incredibly common, especially as we get older and our skin has been exposed to the sun for many, many years. We're talking here about something called basal cell carcinoma. Now, don't let the word carcinoma instantly make you panic. Basal cell carcinoma, or BCC as doctors often call it, is the most common type of skin cancer. But it's also the least dangerous in the sense that it rarely spreads to other parts of the body. It grows slowly, and it usually stays right where it started. However, that doesn't mean you should ignore it. If left untreated, it can continue to grow deeper into the skin and can damage the tissue and bone underneath, especially if it's on a delicate area like your nose or eyelid. Catching it early is key because it's usually quite simple to treat when it's small. Think about that little bump you might have noticed. Does it fit the description? Is it shiny, like a tiny pearl embedded in your skin? Does it perhaps have a slightly rolled edge? And maybe you can even see tiny blood vessels on the surface. These are classic signs of a basal cell carcinoma. Or what about that patch that looks a bit like a persistent dry spot or a scar? Is it slightly raised? Or maybe even indented in the center? Does it feel firm to the touch and that sore that just won't heal? That's a really important one to pay attention to. We've all had cuts and scrapes that take time to mend. But if you have a spot that keeps breaking open, scabbing over, and then opens up again, even after several weeks, that's definitely a red flag. People sometimes mistake these for persistent bug bites, or maybe just dry skin, or a scratch they don't remember getting. But the key is that they simply don't behave like normal skin injuries. Normal skin heals. These spots don't. Not completely. Why is this so common in people over 60? Well, it largely comes down to sun exposure over a lifetime. Basal cells are in the deepest layer of the outer skin, and damage from the sun's ultraviolet UV rays can cause changes in these cells, leading them to grow abnormally. It's often cumulative sun exposure, all the time you've spent in the sun throughout your life, whether it was working outdoors, gardening, or just enjoying sunny days. So, Areas that have seen a lot of sun. Your face, neck, scalp, hands, arms are common places to find these. But, and this is important, BCCs can appear anywhere on your body, even areas not typically exposed to the sun, although that's less common. That's why getting into the habit of checking your skin all over is so important. Imagine you're just drying off after a shower, or perhaps putting on lotion. Take a moment to really look at your skin. It takes just a few extra seconds. Look at your face in the mirror. Really look. Check behind your ears. On your scalp, it can help to use a comb to part your hair and a mirror. Look at your neck, the back of your neck too. Check your arms, the tops of your hands, and don't forget between your fingers and fingernails. Move down to your body, your chest, abdomen, and back. You might need a hand mirror to see your back, or ask a partner or family member to help. Look at your legs, the tops of your feet, and yes, even the soles of your feet and between your toes. Basal cell carcinomas are less common in these less exposed areas, but they can still happen. If you spot something that looks like that pearly bump, that flat, scar-like patch, or that sore that keeps coming back, what should you do? The most important thing is not to ignore it. Don't wait for it to change dramatically, or for it to become painful, because often they aren't painful, which is why they are silent. Make an appointment to see your doctor. You can start with your primary care physician, who can take a look and decide if you need to see a dermatologist, which is a skin specialist. Seeing a doctor doesn't automatically mean it's cancer, but it's the only way to know for sure. They might need to do a biopsy, which is a simple procedure where they take a small sample of the spot to look at under a microscope. It sounds a bit intimidating, but it's usually quick and done right in the doctor's office. If it is a basal cell carcinoma, the good news is that because it's usually slow growing and doesn't spread, the treatment is often very effective, especially when it's caught early. It might involve surgically removing the spot, or other treatments depending on its size and location. The main takeaway here is that noticing these common, often subtle changes, the pearly bump, the flat firm spot, the non-healing sore, and getting them checked is a simple, powerful step you can take for your health. Don't brush them off as just another sign of aging or a stubborn blemish. Now that we've discussed the importance of watching out for those pearly bumps and non-healing sores that might signal a basal cell carcinoma, let's move on to another common type of skin change that also needs our attention. This one often looks quite different, and it's called squamous cell carcinoma. You might notice this one as a firm, red nodule, perhaps with a rough or scaly surface. It might also appear as a flat sore with a scaly, crusted surface, unlike the smooth, pearly look of a typical basal cell carcinoma. Squamous cell carcinoma often feels rough and might even bleed easily if you scratch it. Think about a persistent rough patch, maybe on your hand or arm, that just doesn't feel like dry skin or a typical rash. You might apply lotion, but it doesn't go away. It might even get a little bigger or thicker over time. Or consider a bump that feels hard and tender, maybe on your lip, ear, or scalp. Like basal cell carcinoma, squamous cell carcinoma, or SCC, is also strongly linked to lifetime exposure to the sun's UV rays. It often appears on areas that get a lot of sun, like the face, ears, lips, scalp, neck, hands, and arms. However, it can also develop in chronic sores, scars, or even in areas that have been exposed to certain chemicals or radiation. While SCC is more likely to grow deeper into the skin and spread to other parts of the body than BCC, it's still generally slow-growing and has a very good prognosis when caught and treated early. The danger comes if it's ignored and allowed to grow and spread. So, what should you be looking for specifically? Pay attention to any persistent rough or scaly patches that don't clear up. These are sometimes called actinic keratoses, and while they are not cancer themselves, they are considered precancerous lesions that can turn into squamous cell carcinoma over time. If you have a number of these rough spots, especially on sun-exposed skin, it's a good idea to have them checked by a doctor, but a squamous cell carcinoma can also appear as a new, standalone lesion. Look for that firm, red bump or nodule. Does it feel tender when you touch it? Does it seem to be growing relatively quickly? And that flat sore with a crusted or scaly surface, does it look like it's not healing? Similar to the non-healing sore we talked about with BCC, but perhaps rougher or more crusted. Let's think about a common scenario. Maybe you have a spot on the back of your hand that you just assumed was an age spot, or maybe just very dry skin. You've put hand cream on it diligently, but it hasn't gotten any smoother. In fact, it might feel rougher, almost like sandpaper, and perhaps it's slightly raised. This could be an actinic keratosis, or it could already be a squamous cell carcinoma. The point is, if a patch of skin feels persistently rough, scaly, or crusted, and it doesn't resolve with regular moisturizing, it warrants attention. Similarly, a new, firm, red bump, especially one that's growing, shouldn't be ignored. Sometimes people might think it's just a stubborn ingrown hair or an irritated spot. But if it persists and grows, it's important to get it checked. Just like with checking for basal cell carcinomas, the best way to spot a squamous cell carcinoma is by getting to know your own skin through regular self-examinations. Set aside some time each month to look closely at your skin, from head to toe. Use mirrors, especially for hard-to-see areas like your back, the back of your legs, and your scalp. Pay special attention to areas that have had a lot of sun exposure over your life. Feel your skin as well as looking at it. Does anything feel rough, thick, or tender that used to be smooth? Are there any new bumps or sores? If you find something that looks like a firm red nodule, or a persistent, rough, scaly, or crusted patch or sore, don't hesitate to call your doctor. Again, seeing a doctor doesn't mean it's definitely cancer, but it's the right step to take to get an accurate diagnosis. They will examine the spot and might perform a biopsy. Treatment for squamous cell carcinoma, when caught early, is usually quite straightforward and effective. It might involve surgery to remove the lesion and a small amount of surrounding healthy tissue, or other treatments like radiation therapy or topical medications depending on the specifics. The key message here is vigilance. Don't dismiss persistent rough patches, scaly areas, or firm, red bumps as just age spots or dry skin. Your skin is constantly changing, but some changes are more significant than others. Knowing what to look for and taking action when you see something suspicious can make a world of difference in catching these silent signs early. When treatment is most effective and least invasive, paying attention to these potential signs of squamous cell carcinoma is another vital part of being proactive about your health as you get older. It's about being informed and empowered to notice when your skin is trying to tell you something important. Those rough patches and firm spots are certainly important to watch for, and recognizing them is a huge step in taking care of yourself. But now, we need to talk about a type of skin change that, while less common than the ones we've discussed, is arguably the most critical to spot early. We're talking about melanoma. This is the most serious type of skin cancer. And unlike basal cell and squamous cell carcinomas, which often stay put or grow slowly, melanoma has a higher chance of growing quickly and spreading to other parts of the body if it's not caught very early. However, the good news, the really important good news, is that when melanoma is detected early, before it has a chance to grow deep or spread, it is highly treatable. That's why knowing the signs is so incredibly important. Melanoma often develops in an existing mole or appears as a new dark spot on the skin. We all have moles, and most moles are completely harmless. They are just clusters of pigmented cells. But a melanoma happens when these pigment cells, called melanocytes, become cancerous. So, how do you tell a normal mole from a potentially dangerous one? There's a simple guide often used by doctors, sometimes called the ABCDEs of melanoma. It's a helpful way to remember what to look for. and we can break it down simply. Let's go through each letter. First, A stands for asymmetry. Imagine drawing a line through the middle of a mole. If one half doesn't match the other half, it's asymmetrical. Normal moles are usually symmetrical, meaning if you cut them in half, both sides would look pretty much the same. If your mole is uneven or lopsided, that's a warning sign. B stands for border. The border or edge of a melanoma is often irregular, ragged, notched, or blurred. Normal moles usually have smooth, well-defined borders. If the edges of your mole look messy or hard to distinguish, it's something to pay attention to. C is for color. This is a really important one. Melanomas often have varied colors within the same lesion. You might see shades of brown, black, white, red, or blue. A normal mole is usually just one color, or maybe a consistent shade of brown. If your mole has multiple colors, or if the color is unevenly distributed, get it checked. D is for diameter. Melanomas are often, but not always, larger than 6 millimeters in diameter, which is about the size of a pencil eraser. Now, don't dismiss a spot just because it's smaller than that. Some melanomas can be quite small when they are first detected, but if you have a mole that's larger than an eraser head, it's worth keeping a close eye on, especially if it has any of the other ABC features. And finally, E stands for evolving. This is perhaps the most crucial sign of all. Evolving means the mole or spot is changing in size, shape, color, or elevation. It might also start to itch, bleed, or become crusted. Any change in a mole over time is a significant warning sign and needs to be evaluated by a doctor promptly. Normal moles usually look the same year after year. A mole that is evolving is sending a clear signal. So, when you're doing your skin checks, remember the ABCDE's asymmetry, irregular border, multiple colors, diameter larger than a pencil eraser, and most importantly, anything that is evolving or changing. Melanoma can appear anywhere on the body, not just in areas exposed to the sun. While sun exposure is a major risk factor, melanomas can develop on the soles of the feet, palms of the hands, under fingernails or toenails, and even in areas not typically exposed to the sun like the scalp, buttocks, or groin. This is why a thorough head-to-toe skin check is so essential. Melanoma can sometimes be missed because it appears in a hidden spot, or because it doesn't fit the typical mole pattern. Sometimes it can look like a dark streak under a nail, or a sore on the sole of the foot. Certain factors can increase your risk of developing melanoma. These include having a history of sunburns, especially blistering sunburns in childhood, having fair skin, red or blonde hair, and light-colored eyes also increases risk. If you have many moles more than 50, or if you have atypical moles that look unusual, your risk is higher. A family history of melanoma also increases your risk, if any of these risk factors apply to you. It's even more important to be diligent about checking your skin and considering regular skin checks with a dermatologist. Now, let's tie this all together. We've talked about the pearly bumps and non-healing sores of basal cell carcinoma, the rough, scaly patches and firm red nodules of squamous cell carcinoma, and the importance of the ABCDEs for spotting melanoma. It might feel like a lot to remember, but really, the core message is simple. Get to know your skin, pay attention to changes, and if you see something suspicious, get it checked by a doctor. Don't try to diagnose yourself, and don't wait, hoping it will go away. Early detection is your best friend when it comes to skin cancers. Being proactive about checking your skin is one of the most powerful things you can do for your health as you get older. It's a simple habit, maybe just 5 or 10 minutes once a month. That could potentially save your life. Think of it as a regular health check that you can do yourself in the privacy of your own home. And if you have a partner or a family member, ask them to help you check those hard-to-see areas like your back and scalp. Make it a shared habit. Remember, finding one of these suspicious spots doesn't automatically mean the worst. Most skin changes are benign, but only a doctor can tell you for sure. Getting it checked is about gaining peace of mind or getting timely treatment if needed. It's about taking control and being an active participant in your health journey. This knowledge about silent skin signs isn't meant to create fear, but to give you power. The power to notice, the power to act, and the power to protect your health. So, next time you're getting dressed or stepping out of the shower, take a moment to look at your skin. Be curious, be observant, and be proactive. It's a small effort for a potentially huge reward. Knowing what to look for on your skin is truly empowering, isn't it? It's like having a secret map to better health, hidden in plain sight on your own body. We've walked through some important territory today, exploring those silent signs our skin might be showing us, from those common pearly bumps and non-healing sores that could be basal cell carcinoma, to the rough, scaly patches and firm nodules pointing towards squamous cell carcinoma. And critically, the changes in moles following the ABCDEs that could signal melanoma. It can feel a little overwhelming at first, thinking about all the things that could potentially be wrong. But let's reframe that. Instead of feeling overwhelmed, feel informed. You now have knowledge that many people don't, and that knowledge is a shield. It allows you to approach checking your skin not with anxiety, but with a sense of purpose and self-care. It's not about constantly worrying, but about regular, calm observation. Remember, small changes can indeed make a big difference, not just in preventing illness, but in catching things early when they are most treatable. Adding a regular skin check to your routine, perhaps on the first day of every month, or every time you change the sheets on your bed, is a small habit that offers immense protection. It's an investment in your future health and happiness. And it's not just about finding something potentially serious. Regular skin checks also help you become intimately familiar with your normal skin. You'll learn where your moles are, what your freckles look like, and which little bumps are just there. This familiarity makes it much easier to spot when something is new or when something is changing. You become the expert on your own skin, which makes you the best person to notice when something is out of the ordinary. If you've been watching and thinking about a spot you've noticed, please don't let fear stop you from taking the next step. Pick up the phone and make an appointment with your doctor. Share your concern. Describe what you've seen. They are there to help you. And they would much rather you come in to get a harmless spot checked than miss something that needs attention. There is no shame in being cautious about your health. Only wisdom. Sharing this kind of information is so important, and I hope you found it helpful. If you have any thoughts or perhaps a story about a time you or someone you know noticed a skin change that turned out to be important, please share it in the comments below. Your experience could help someone else who is watching and wondering. And if you found this video valuable, please give it a like. It helps more people see this important information. And don't forget to subscribe to the channel. We cover a lot of topics here aimed at helping you live your best life at every age. And you don't want to miss out on future tips and advice. Ultimately, taking care of yourself as you get older is about embracing life fully. It's about having the energy to do the things you love, the health to enjoy time with your family and friends, and the peace of mind that comes from knowing you are being proactive about your well-being. Paying attention to the silent signs your body might be giving you is a fundamental part of that. Your skin is your body's largest organ, and it can tell you a lot if you just take the time to look and listen. Be vigilant, be informed, and be empowered. Live your best life at every age.